Hello, Foundations. This is Dr. Davis again. We are going to be talking today about critical thinking and therapeutic communication. If you are looking to follow along, this is ATI chapter number 8, Davis chapter number 2. The initial information was received from the ATI information, so that is what I will be covering today. So, what is critical thinking and why is it important? So critical thinking you are going to hear about the entire time you're in nursing school. We're going to talk about critical thinking skills. So what do we mean by that? So that is, critical thinking is taking knowledge that you have, that you've gained through the classes that you've taken. So biologically, socially, any of your physical science, your pathophysiology, your nursing procedure, your nursing skills. So a lot of those things we're going to be teaching you. But some of you have an inherent critical thinking brain. So you already think critically. So there's a lot of different ways to critically think. So you're going to have to use that then, these critical thinking skills, to then make clinical judgments. So what do I mean by clinical judgment? So with clinical judgment, I take those skills that I've learned and all that information that we've taught you, and we're going to use that to make judgments about our patients. So we're going to have to interpret, we're going to have to analyze, evaluate, and explain information to our patients and to other members of the healthcare team. We need to be able to make judgments about problems in nursing practice. So if we're starting to see something, maybe, for example, your hospital decided to purchase an IV catheter. Okay, so the actual needle that you're sticking your patients with, sorry. So the needle you're sticking your patient with is an IV catheter, right? It's going to have a sheath of plastic on top of that needle. Just the end of the catheter will have the needle sticking out. So that's actually the part that goes in the skin. Once you get it into the vein and you know that you've got good return, you slide that plastic catheter on up, and then you're going to, usually there's a button, there's something that will make that needle retract. And once that retracts, then all that's left in the patient is a piece of plastic. So just that plastic end. So maybe your hospital decided to purchase a different brand of IV catheters because it's cheaper, okay? Or they're able to get them in bulk, and therefore it becomes cheaper to purchase from there. But you've noticed that you're having more of patients' IVs below. So you're having to restart IVs a whole lot more because of an issue with understanding the mechanism of the IV catheter, or maybe you feel like the needle's not as sharp. So when you find things like that, that's taking that information, and then you need to report that up the chain. So you're making a clinical judgment. You have your knowledge base, which is what we're giving you, and then you're going to take that information, you're going to pull stuff from all the way back in when you started school. You know, you're going to pull things from anatomy, you're going to pull things from psychology, from human growth and development, all those different areas to make clinical judgments about for your patient or about your patient. So why is this so important? It's important because a proactive nurse, so a nurse who can think proactively, kind of think in the future about your patients and kind of foresee problems. So I foresee in the future that if this patient stays on this medicine very long, they're now going to have another issue. All right. So let's try. I'm just going to make something up. So I have a patient that is getting a lot of potassium. So potassium is real important about heart and the contractility and all that other good stuff, okay? But it's also part of your fluid and electrolytes. So this patient was low on potassium. We're giving them large amounts, but maybe this patient doesn't void or urinate like they're supposed to because of some sort of kidney damage. So what you're foreseeing is that it's okay right now for us to give this patient extra doses of potassium, but that's going to build up, and then we're going to have the opposite problem with this patient. So it's thinking in advance, thinking down the road of what could happen with these patients. So that's one of the things that's really important. You have to be able to make good you have to be able to problem solve. You have to be able to make decisions. You have to think through different solutions for your patients. All right. There's many a time I worked in OB for 15 years, 16 years. And when I left, I kind of did an assistant administrator kind of a position. And then filled in for the administrator while she was out for an extended amount of time. So in order to be in that position, I had to have a good knowledge base. And so I was considered one of the more senior nurses. I had the experience and the background in order to be in this position, right? So many times I would say, and just gather up, if I had an issue with a patient, I'd gather up a few of the nurses and say, hey, what do you think about this? What do you think would our outcome be if we did this versus something different? We would all the time come together and look at fetal monitor tracings, which can be, related to looking at EKG strips with your fellow coworkers. So that's also going to be part of critical thinking, is knowing when you don't know the answer and being willing to go find out what the answer is. Okay, so that's another really big important piece that I want to add in there. So critical thinkers are people who are interested in lifelong learning. Okay. I just finished my doctorate. I have been in school literally since I graduated nursing school. I had a short break. I did my BSN, took a short break, did my master's, went straight into get my DMP. So I have been in school for a very long time. You want to be able to be interested and always be learning. Because that's the thing about nursing, is there's always going to be something new. Critical thinkers have knowledge, they have experience, they have an attitude for intellectual and professional standards. So, they're not going to make shortcuts because it's easier for themselves if that's not part of what you should be doing. Critical thinkers are always looking for the truth, and they're very open-minded. They're inquisitive. So I'm going to ask questions. So sometimes physicians don't always react really great to questions because they think that you're trying to undermine them or question their ability. And sometimes everybody feels a little bit undeserving. That's not what I'm trying to think. But people, if you have someone constantly asking you questions, it can maybe undermine your strength and your confidence. That's what I was trying to get to. So asking questions in a hey, I don't understand how this works. Can you explain it to me? Versus, why in heaven's name are you doing this? Okay, those are two different questions, but I might be getting to the same answer. My answer is still going to come back down to I don't know, I don't understand this. So phrasing questions in the appropriate way is really important. And if you develop a great relationship with your physicians or your providers, then you'll be able to have those conversations with them and just say, well, what about this? Or, this is what we learned in nursing school, but this is very different from this. So why would it be different? So that's how you continue your learning. As nurses, we usually make inferences about clinical decisions. That means I pull all the information from different sources, right? I look at patients' laboratory values. I look at their x-rays. I look at their vital signs. I look at the patient and talk to the patient, okay? So I take all that data and combine it and come up with what I feel is the best plan for that patient. As a critical thinker, you need to reflect about what you're doing. You need to think about the language that you use when you speak to patients or to your other coworkers. You need to have a little bit of intuition. So you have to kind of anticipate and kind of listen. Everybody has that voice in their head or in their gut, as people will say. I've got to listen to my gut. You have that's intuition. Something is telling you, your brain is saying, hey, something's not right here. So make sure you listen to that intuition. Reflection is really important as a nurse because you have to think back to what happened in the situation. What could you have done to make that situation better, or what could you have done to improve the situation? So that's always important, especially in, say, a code situation. You need to think about, why did I say this, or why did I do this? Was there another way that I could have done that would have been better? That's really important as well in if you're in a situation where there is, say, a code for a patient, that you sit down with your fellow nurses and ask, what do you think I could have done better? Now, they may have not been paying attention to you at all, but it's possible that they noted that you did this instead of this, and maybe next time you could do this better. So you have to take everything with a grain of salt, get that information back from other people, and see what really worked well for you. Okay, therapeutic communication is what we're going to discuss next. And it is ATI chapter 32, Davis chapter 20, and that's therapeutic communication. So what is communication? So communication is that process where you send and receive information between two or more people. So you have to communicate with someone. Many of us like to talk to ourselves, right? Because we get the answer that we want usually when we talk to ourselves. But really, communication is between two different people. So communication is that information going back and forth, and those two people work together in order to come up with a goal, even if that's just an answer to the question. Okay, so that's kind of communication. So why is it important? So we need to be able to communicate effectively, because as nurses, we are going to be the physician or the provider's eyes and ears, right? The physician cannot take care of, he may have 100 patients in the hospital. There's no way for him to take care of all 100 patients at the same time, except that he has nurses that are his eyes and ears. So physicians, you have to be able to clearly communicate with physicians of what is happening with their patients, what you see as a nurse, what you think as a nurse, and then get the information back from them, and then therefore move forwards. Okay, so communication is very important. There are several basic levels of communication. You've got intrapersonal communication. So that's what I was just talking about when we talk to ourselves. So that's our self-talk. So in my mind, as a new nurse, I'm going in for that first day of clinical. All right, I'm going to be very nervous because I've never been in a clinical setting before. So I go into that room and I'm saying to myself, okay, remember to do the vital signs. You want to take the temperature first and then do the blood pressure. I'm going to go through all those things. And I want to be positive. All right, so you're going to hear this a lot from me because I'm a great believer in being positive with yourself, and even taking, negative things and trying to turn them into a positive, because I've seen it happen. I've seen that it works for students to actually go in with the idea that I am going to do well, or I'm going to do the best of my ability. If you go into the situation saying, oh, I don't know how to do this, everything is wrong, I'm going to be terrible, do you really feel like you're then going to perform to the best of your ability? No. So intrapersonal communication is that self-talk that you're doing with yourself. Interpersonal communication is between two people. So if myself and Mrs. Rollerson are trying to communicate about students and what we think is best for a topic that is coming up, then that's interpersonal. The two of us are communicating and we're trying to come up with a plan. Public communication is just that. That's with you giving information to, say, a large group of people. Many times you'll see nurses lead, like community outreach kind of things. Maybe they're going to be teaching a class on type 2 diabetes. That would be something that would be done in a public setting. And then small group is just that. So a small group of people, maybe it's just a committee where you have 5 or 6 people. Maybe it's a support group. So a very small group is another version of communication. So there are some functional components of communication. So some things, some parts of communication that are really important to understand. So, and these are more vocabulary words. So the referent is the motivation for communication between two people. So think of that as the question. I have a question that I need answered, so I'm going to email Dr. Davis and ask. All right, that's the reason. Why am I doing it? That's the referent. The sender is the person that sends the information, where the receiver receives the information, right? The message. So the message is the verbal and the nonverbal information that the person expresses. So right now, we're doing a lot of emailing and texting, so you can't really get nonverbal information from people. And what do I mean by nonverbal? It's those, where do you put your hands? Do you have your arms crossed? Do you have a facial expression of being frustrated with the patient? Those are all nonverbal, okay? So the channel is the method of transporting this message. So maybe I'm in the room with a patient who's very upset, and I touch their shoulder and say, I'm sorry that you're having a bad day. Is there something I can do to help you? Okay, your facial expression, your hearing, your body language. So all that stuff is really important. That's the channel. The environment is the actual environment that you're in. Maybe it's at the patient bedside and they've received upsetting information. So that emotional climate could be very tense or very sad. Or maybe it's the physical climate. Maybe I'm outside and responding to an accident that happened. in front of me while I was in my car. So that physical climate would be different, okay? Feedback. So you can get feedback that can be verbal, nonverbal. It can be good feedback. It can be bad feedback, okay? And like I said, you've got to be able to take even the negative feedback and turn it into a positive, because everything is a learning experience. You're not going to do everything right the first time. You're not going to do everything right the 5th time. It happens. So you just do the best that you can and move on. There is, I don't know if you remember when you were younger, maybe playing a game called telephone or something like that, where it's a whole line of people, and somebody starts at the beginning and has a little statement, whispers it to the next person who whispers it, and you get to hear how much it has changed by the end. So remember that sometimes the message the receiver is receiving is not the message that you sent, okay? So try to really take a lot of steps to, if you're wanting to communicate with a person, don't go through another person. So what are some of the methods of communication? So you can have verbal communication, right? So you can have, that's your vocabulary. How do you speak? Do you talk using very large words? Do you speak above the level that of your patients? Because you're going to have to learn that not everybody understands the same vocabulary that we understand, right? So when you're trying to explain things to patients or patients' family, using medical terminology is not always the best thing. Also, if you are trying to speak to a child or an adolescent, you're going to have to understand that you're not going to be able to speak to them the same way you can an adult, okay? Your credibility. So are you trustworthy and reliable? So many times patients would ask us questions, and I know this sounds very strange, but you're not always going to know the answer, okay? So sometimes that means saying to that patient, you know, I really don't know, but I'll find out and I'll get back with you. So they will, you'll be more credible to them if you actually do that, okay? Don't tell them you're going to go find out and never go back, all right? If you're telling somebody that, yes, I will answer your question, but it's, you know, I've got to go find the answer because I don't know. Go back and tell them what answer you found, even if it wasn't the greatest answer. Say, look, this is all I've got. I did send the information to the physician, and hopefully when they come in this evening, they'll be able to address that with you. All right, so patients will trust you much, much more if you tell them the truth. If you try to just make something up, then they know it, because after a little bit, they'll be really then not wanting to believe what you've got to say. Clarity and brevity. So by this I mean you want to give short answers. Don't let them be long and complicated. Try to pare that information down and just give them the shortest, simplest information that you can. All right. Timing and relevance. All right. So a patient just received news that he has cancer. Is that a great time to talk about what he would like for dinner tonight? No. All right. Timing is very important. All right. If I've just been given really bad news, I don't need to then have somebody come in and ask them for their copay. Okay. So understanding timing. Make sure that if patients are not comfortable, so if I'm in a lot of pain, I'm not going to listen to what you're telling me. I'm not going to be happy to answer your questions because I'm hurting. All right. Pacing. So do not speak really quickly. Especially right now, we all have the issue with wearing masks, and so many patients, many more than you think, actually read lips. So talking quickly may really inhibit how you are able to get your idea across to the patient. Okay. Intonation, so that's really important. So how am I saying something? So I don't know if you've heard this, but I tend to say this frequently at my house, is it's not what you say, it's how you say it, right? So you can tell somebody something in a very, the same information, and by changing your tone of voice, I can make it a negative statement or a positive statement, right? If I'm telling somebody thank you, if I say thank you so much for helping me with all this stuff, or helping me take care of my patient today, or I say thank you for helping me take care of my patient today, which one sounds nicer, right? The first one, that's your intonation, okay? So your nonverbal parts of communication, that's your hand gestures. How are you standing? What facial expressions are you making? Crying and moaning can sometimes sound the same, and you're not sure, is the person upset or are they in pain? So that's something to think about. Territoriality, so personal space. Being all up in somebody's personal space, some patients are very uncomfortable with that. So understanding your patient and their culture and the reasons they may not want you to be right up in their personal area is really important. Okay, electronic communication. So what falls into the electronic communication area? So that would be emails, emails to patients maybe. A lot of facilities are doing that now. They are allowing nurses to communicate to patients or clients via email, but these are going to be over encrypted systems, meaning that they will have some sort of password protection on them. They won't be sent on just a regular Gmail address, okay? There's going to be a lot more security in that. Some facilities allow you to text your physician because maybe you can't get a phone call to the physician because he's seeing patients, but maybe you could text him. Now, that's not over your regular Verizon or AT&T wireless. This is something, it goes through a specific app that is coded for patient confidentiality. I know the one that we originally started using was through Tiger Text. They may or may not be still doing that anymore, but that was a way that we could text our providers without using regular provider services, phone services like AT&T or Verizon, just our normal texting, okay? So what makes communication therapeutic? So communication is therapeutic when you maintain and build a relationship with your client, their families, or significant others. Now, I'm not saying invite your patients over to eat Thanksgiving dinner with you, okay? I'm saying when you're building a relationship, that means that they know that as a nurse, they can trust you, you're going to take really good care of them, okay? So that is really important as you're taking care of and making someone feel like the communication is therapeutic. You want it to be patient-centered. If you're taking care of children or older adults, you want to make sure that the communication is very clear. You don't want to use big words. You want to really have a goal when you start doing your therapeutic communication, and that may be your patient education at discharge. So maybe the goal is to discharge the patient home, but you need the patient to understand the information in order to send them home. So you want your communication to be therapeutic. All right. Number 3, what's considered the essential components of communication? So time. Make sure you have time to sit down and do, say, your discharge teaching. Okay. If you're trying to discharge 3 patients all at one time, that's not going to work because you're not going to have time to discharge everybody. Now, working with postpartum, so mamas and babies who are going home, I might be taking care of 4 moms and 4 babies. That's 8 patients. So 8 patients are discharged. Sometimes you'll have all 4 of them going home. So you're doing teaching on 2 patients, right? Because you have to do discharge teaching on mom and baby with mom. So it's a lot of discharge teaching. So making sure, I would usually, if I had multiple discharges, find out what the patient's schedule is. Some of these people may not or may be needing to go home quicker because of a ride situation. You may know that some specific doctors will discharge their patients early, so maybe you can get those done first. So having a plan of how you're going to discharge these people and make sure you have adequate time. Be attentive, don't be distracted. Use active listening. And what do I mean by active listening? So if I do some teaching with them, I might say to them, can you explain to me in your own words what we just talked about? So that's kind of also called teach back. But when we're actively listening, we're listening to what the patient says, we're reacting to it, and we're acceptive of it. We want to make sure that we're caring and kind. You want to be honest, trustworthy. You want to give empathy. So we, as nurses, we want to empathize. We don't sympathize, okay? I know they're very close, but empathy is just, you're going to convey the awareness that you understand the feelings, emotions, and try to kind of envision what it might be like to be there in their position. Where sympathy, you really are more pitying the patient, and so that's not something that we do. Okay, we empathize, and you have to be non-judgmental. You're going to meet so many different people from all over the place, and everyone is going to be a little bit different. So make sure that you're non-judgmental and that we treat everyone the same. So what are some of the effective skills that nurses can possess? All right. So some people have a problem with this first one, silence. All right. So my family, I'm married and I have 2 children. We are all very comfortable with riding in the car and just listening to the music. We don't feel the need to constantly be talking. Now, my mother-in-law is quite the extrovert. As soon as she gets in the car, if it is 5 o'clock in the morning, she is talking until she gets out of the car. All right. If nobody is talking to her, she's going to talk aloud to herself, reading road signs. Anything else, she just likes the noise. So you have to be comfortable with the silence, because sometimes you have to allow people to think about what they're going to say before you continue on talking to them. Okay. We want to present reality. So what does that mean? So sometimes you have patients who may have some sort of a delusion or a hallucination. Maybe they have a belief that isn't correct. I've had patients who would come in and we would tell them, working in OB, that maybe they had a sexually transmitted infection. And many times they would want to say back to us, oh, I got that from a toilet seat. Well, that's a faulty belief. Usually sexually transmitted infections, so STIs, are not transmitted by toilet seats or dirty washcloths. Okay, so having to explain that that's not quite right is very important. So active listening, we talked about that, but sometimes in active listening, what you have to do is take in the information that the patient is giving you and re-say it back to them, because maybe what they're saying doesn't make a lot of sense, but if you rephrase it and give the information back to them, then they can say, oh, maybe that's not what I meant. Okay, make sure you ask questions, and when you're asking questions, they need to be open-ended. Okay, sometimes we need yes and no questions. Okay, those are called closed-ended because that's all you need is a yes or a no, right? Open-ended questions are questions where you're asking them why, how, those kind of things. Patients have to answer more than yes or no, right? They have to tell you what's going on. So open-ended is very important. So clarifying techniques, and that's some of the stuff I've started talking about, is restating what the patient says. So when the patient tells you something, you restate it back to them, because sometimes when they hear it back, they're like, oh, no, that's not what I meant to say. Reflecting, so try to focus the patient back onto how are they feeling about the situation. So I've just received news that I didn't want to hear. We're asking the patient, to examine those feelings so you can talk about them. Paraphrasing, so we want to restate the patient's feelings. So however they say it to you, you restate it and say it back and say, am I understanding you correctly to say that you would like more pain medication? You're restating it. We want to offer broad statements. We want to show acceptance for our patients. We want to try to focus. This is a hard one sometimes, especially for new nurses. You're trying to admit a patient and you have to go through all these questions, and maybe your patient just really wants to explain paragraphs of information every time you ask a question. So sometimes you have to focus them back in and kind of almost, and with some patients you even have to interrupt a little bit and say, wow, that's a really interesting story, but let's talk about why you came here today, okay? We have to give information to patients while we're trying to get them to understand what they need, the information they need to make a decision. We'll summarize what happened. Sometimes effective skills is just touching the patient on their arm or on their shoulder to just say that it's okay, I'm here with you. And then sometimes sharing feelings with the patient. If you're upset, then you may need to share that with another nurse. So making sure that you share your feelings as well. Okay, so how do I combine therapeutic communication with the nursing process? So we are, your next lecture little series will be about the nursing process. And we will talk about it a lot. That's the basis for nursing, is the nursing process. So some of the steps are here. Your assessment and data collection, your planning, your implementation. The only thing that's missing is your E, which is evaluation. So I will talk a little bit about this, but you may want to come back and listen to this slide after we discuss the nursing process, because it might make better sense to you then. Okay, so in assessment and data collection, so I'm assessing my patient and I'm collecting the data that I get from my assessments. what do I mean? So I am going to listen to my patient's heart and lungs. The data I collect is, what does his heart sound like? What do his lungs sound like? Okay. So those are always big things that we need to discuss. That's assessment and data collection. So also you're going to ask patients questions. You're going to say to the patient, hey, you'll say to the patient, where is your pain? So you're going to ask questions and you're going to assess different things. From those assessment questions is where you're going to get your data and how you're going to move through that nursing process. Okay. Planning. So your planning is the stage where you decide what's the most important thing that we need to do for this patient. How do we take those things that we found in our assessment and now have a plan of what we're going to do to take care of our patient. So you're going to provide privacy. You're going to talk to your patient and come up with a agreed upon outcomes. We're going to set priorities. And then implementation. So this part is simple in being that implementation is how are you going to carry it out. Okay, this is my plan. My plan is my patient didn't get a lot of sleep last night. He's very exhausted and irritable. So the plan I am coming up with is to try to allow that patient to sleep today. How am I going to implement it? So how am I going to carry that out? I'm going to try to cluster his treatment. So maybe I need to bathe him and do his vital signs and do his assessment. What if I did all three of those things at one time? That's possible. So I'm going to cluster those things, how I'm going to implement it. All right, last slide for therapeutic communication. So what are these barriers to communication? So some things that become an issue when you're communicating. Asking someone an irrelevant personal question. If it's not any of your business, you don't need to ask it. If it doesn't pertain to how you are taking care of the patient, you don't need to ask it. Okay? You don't offer a personal opinion. Many times you will get patients who will ask, well, what would you do? And you just have to learn to rephrase that and give them the information again that the physician just gave them and restate it, because we don't want to offer personal opinions. We don't want to stereotype. We don't want to give advice or give false reassurance. All right, somebody's going into surgery to have a massive surgery done. The last thing you want to do is say to your patient, you're going to be fine. Okay, because we really don't know that you're going to be fine. Okay, don't say that to your patient, because what if they come out of their surgery and something crazy happened and they had to have their leg amputated? Are they going to say to you when they see you, you said I was going to be fine? Okay, don't tell your patients that. Just offer reassurance. Hey, I'll be here when you wake up. Or, something else maybe that's positive. These doctors, they have studied a long time to do these procedures. They do them all the time, and their outcomes are really good. Something besides, you're going to be fine. Don't change the topic. Don't challenge the patient. Don't test them or judge them or argue with them. Those are all things that can be a barrier to communication. So what about communicating with other health professionals? So incivility is something that you'll hear about. That is sarcasm, eye rolling, being rude to each other. So that behavior between nursing colleagues. All right, bullying, that can happen a lot, unfortunately, in healthcare. Lateral violence, so abusive words or actions between peers. So those are all things that can happen. You need to be aware of it, and you need to be aware of what to do if you're being treated that way.